as promised, here are some of the signs and symptoms that you can look for to identify if a stress reaction might be something that you're dealing with. And these clinical signs are actually really important because they help differentiate between other types of injuries, like, say, for example, like a tendon injury or something along those lines. So the pattern is pretty predictable and consistent from person to person, and we're talking here is the early stages of a stress reaction or injury to the bone. So pain is often usually described as something that's kind of like vague or diffuse, like just like in a general area, as opposed to being able to like pinpoint it with your finger. Again, along those same lines of being vague and diffuse, the pain is often pretty mild. And the pain only occurs when running. So it occurs when the bone is actually stressed. So this can occur when running at maybe a certain mileage it starts. It could occur at certain speeds. Maybe you're able to tolerate running at a slower than normal pace, but when you try to push your pace, the pain starts to kind of creep on. Or it could even be at a certain part of the stride. So a certain part of your gait cycle might just stress the injured bone enough that you kind of feel something uncomfortable. A key factor in all of these clinically is that the pain does not warm up. So when you contrast this with something like a tendon injury, people will usually say once they get going with a tendon injury, it kind of starts to feel a little bit better and then it might stiffen up a little bit afterwards. So these bone-related injuries are kind of the opposite in a way, how they present, because what typically happens in the early stages is after someone is done running and the stress is taken away, they really don't tend to have too much pain at rest, or any pain at all really at rest, or when they're walking and doing their normal day-to-day routines in the earlier stages. As obviously things progress, which hopefully they don't, but if they do, is when you start to see things like pain at rest or pain with walking. And I drew this little like squiggly line here. This is often what the course of symptoms kind of looks like. So as activity increases, pain goes up. As you rest and take the stress away, pain goes back down. And this process just kind of keeps going and going and going because the bone's not really getting adequate ability to recover, heal, and remodel, and then ultimately adapt and get stronger. So if symptoms are progressing in this way, it's only a matter of time before the periods where it feels good are going to start to decrease, and the things that make it hurt are going to kind of go up. So what happens is when this is left untreated, when the bone stress injury or the stress reaction just starts and is left untreated over time, and you continue to run, things tend to get a little more aggravated, and that's when you have things like pain becomes very localized. You can kind of point to it, like someone might say like right in the neck of their femur or the bone in their thigh. They can point kind of right where the pain hurts, and the pain is more severe. Oftentimes at this point, when it gets to this, there's pain with basic activities like walking or just anything that really is stressing the bone even a little bit, which is a sign that things have gotten a little bit more problematic. What's concerning about these types of injuries is that, and I've seen this multiple times, right, is when a medical professional is not proficient in treating runners, or they're not used to treating this population of people. And I say runners, but anything, even soccer players, you see a lot of stress reactions, stress fractures, is that they use the x-ray as their kind of gold standard measure. And once they see that an x-ray is clear of a fracture, they clear you to go back to your sport, and they clear you to go back to running. And what is problematic is the fact that these stress reactions do not show up on an x-ray. They're only going to show on an x-ray when you have an actual fracture present. So when it's progressed down that continuum further to a point where we do not want to let it progress to. So having an idea in your head of some of these symptoms is going to help protect you if, God forbid, anything like this happens and you're suspicious of having this type of injury, but you go to a doctor who tells you that things are okay. And I say doctor, it could be a physical therapist, chiropractor, or just a medical professional in general. I'm not trying to knock on any one person or profession. It's just the fact that this is a specific thing to certain athletic populations, including running, and if the person that you are seeing is not familiar with these types of things and what to look for, and the fact that an x-ray is not even gold standard for ruling out the early stages of a bone stress injury, having this in your mind will at least protect you to look further or go to another person.